Red Deer Regional Hospital. Thank you again to Red Deer Polytechnic for welcoming us here, and congratulations on your new degree granting status. Such a great institution of higher education, of practical learning that is going to be a key partner as we prepare young Central Albertans, especially, for the economy of the future. So much great innovation happening here, the Centre of Excellence in Manufacturing and other wonderful specialized programs. You're great partners. Thank you, Red Deer Polytechnic. Thank you to my colleagues, Minister of Education Adriana LaGrange and MLA Jason Stephan. And I'm not sure if I see other Central Alberta MLAs, but I'm also joined by Infrastructure Minister Prasad Panda. We were also joined last night by Transport Minister Rajan Sani as we made a very important announcement for the future of the Red Deer and Central Alberta economy, with a $7.5 million Government of Alberta commitment to the expansion of the Red Deer Regional Airport so that you guys can get regular daily air service here to Red Deer. And I want to thank all of the community members who've been a key part of that whole project. And your worship, Mayor, great to see you again 3 times in a week. We keep checking things off the list, all right? And we're coming to, but with the drug treatment center that we are working to build here, the courthouse, the expansion at the exhibition site, and so much more good work. We're delighted to be partners with Red Deerians, in the expansion of this community and all that you offer to the 500,000 people who live in Central Alberta. And I am so excited to be here with more positive news. This has been a long time coming, and I see a lot of friends have been working on this project for some time. I am thrilled to announce that Alberta's government will provide funding of $3.4 million for a new building to house the Central Alberta Child Advocacy Centre. And friends, that's on top of the $19 million that have already been raised for this project by the organization. And a huge thank you to the amazing Red Deer business people and philanthropists showing the community spirit of Alberta with that kind of generosity. Absolutely amazing. This is an innovative project that'll help protect children and youth in Central Alberta, while also providing on-the-job training for students from Red Deer Polytechnic studying in fields like childcare and child welfare. On top of that, the Central Alberta Child Advocacy Centre is the first project to come through Alberta's new unsolicited proposals framework for projects like this. Civil society organizations, charities, and nonprofits who are in a unique position to know the needs of the community can now submit their proposals directly to the government when they're looking for funding of this nature. At its core, this project is about supporting vulnerable kids. Children who are or have experienced abuse in their homes. Children who are suffering with their mental health. Children who have slipped through the cracks. And we know that there's been more of a problem with child mental health during the COVID era. And so the needs are particularly acute now. Where does a child turn to when he or she is in an abusive situation? A doctor, the police, a counselor, a social worker? Well, this center is all about bringing together all of these resources and more on top of staff employed directly by the center, plus Alberta Health Services medical professionals, law enforcement, and child welfare workers will be housed at this facility. The center will provide counseling to kids who have been abused and prevent abuse from happening to other kids. It will protect kids. It will save lives. Families here in Red Deer and across Central Alberta deserve to know that children are safe and that law enforcement and other government services are doing everything in their power to end the scourge of child abuse. The Central Alberta Child Advocacy Centre brings together a diverse group of professionals dedicated to improving quality of life for children in the region. Child abuse is a horrible reality. Statistics say that 1 in 3 children may be the victim of abuse. This can take many forms: physical, emotional, sexual. In North America, between 100 and 300,000 youth and children are sexually exploited every year, and these are just the numbers that go reported to authorities. Too many Alberta kids experience violence within their home. Domestic violence, which sadly often involves children, is more common than we might think, with the majority of cases going unreported or underreported to the authorities. It is incumbent that we do everything in our power to prevent child abuse in every one of its pernicious forms. As the population of Central Alberta grows larger each year, and as young Canadian families and people from around the globe recognize the amazing opportunities that our province has to offer, the pressure on the social services system will continue to grow. So we need children and youth to know that there are organizations from which they can seek support and escape from dangerous situations. The Central Alberta Advocacy Centre is changing the way that Central Alberta will respond to child abuse. It will work collectively with partners across Central Alberta to ensure that every child's needs are met and that every child is supported in the most effective way. Through their extensive collaboration with local organizations, paired with a hardworking team of, I believe, 9 staff, they're working to bridge the gap between children and not knowing where to look for support to having immediate access to the help that they need. I know that this group is already doing tremendous work in their temporary space, providing in-office mental health therapy services and family support space. I'm hopeful that with this new space, we'll make Central Alberta a real centre of excellence when it comes to protecting kids. The issue of child abuse and child exploitation are not easy ones to talk about. And I want to stop to give great credit to our friend, a great Albertan of Saskatchewan origin, Sheldon Kennedy, for all that he has done as a real leader in this field, in bringing public attention to these critical issues and being a real leader in establishing this model of service to vulnerable kids. I would say that while we have made enormous strides in reducing stigma surrounding the victims of sexual violence, of physical abuse, and of emotional abuse, there's a long way yet to go. I know that some of our other speakers, including Sheldon, will share their powerful stories. Children and youth remain afraid to speak out, often not knowing what resources are available. So thank you. Thank you to the Central Alberta Child Advocacy Centre for the work that you have been doing over the years for young Albertans. Thank you for the vision that has brought us to this day. Thank you for your planning and your fundraising that will result in a tangible life and the difference of hundreds of kids in the future. I'm hopeful that with the creation of the new centre, we are one step closer to ending the scourge of child abuse in Alberta. Thank you, and now I'd like to introduce Minister of Infrastructure Prasad Panda to talk a little bit more about the project. Thank you very much.
Thank you, Premier. Good morning, everyone. It's a great day. It's the first day to be out indoor without masks. But the downside is I can't hide my running nose or my ugly face anymore. So it's and I know His Worship Mayor Johnston is itching to grant me and Premier honorary Red Deerians because we have been here so often. And I want to thank my colleagues, Minister Lagrange and MLA Stefan and other Central Alberta MLAs for their strong advocacy to invest in the critical infrastructure in Red Deer. The new Central Alberta Child Advocacy Center will be an important resource for suffering children. It's also an example of a civil society organization partnering with Alberta's government in a new and exciting ways. And our government is actively pursuing new ways to deliver the public infrastructure Albertans need. And when I heard about this project, I saw an opportunity to work together As Minister of Infrastructure, I invited the Central Alberta Child Advocacy Center to submit a proposal to figure out how we could make this new facility a reality, and we did just that. And as Infrastructure Minister, I approved the Red Deer Polytechnic land lease to house the new center and arranged for government's funding to complement the Central Alberta Child Advocacy Center's donor funds and equity they have already had in place. In fact, to tell you, this project is the first of Alberta's successful unsolicited proposal framework. Congratulations to everyone who worked on this. Usually, infrastructure projects are recommended by either the municipal partners or other levels of government, MLAs, MPs. And sometimes these project proposals fall through the cracks, but when civil society and private industry come forward with good projects like this, Alberta Infrastructure will process them through this USP process. And if you all remember, recently we introduced the Alberta Infrastructure Accountability Act in the legislature, and also the 20-year strategic capital plan, which will provide the metrics for the projects and also predictability and transparency in approving infrastructure projects like this. In this particular case, the partners here, they raised the funds and they are short of infrastructure funding. So Alberta Infrastructure came forward to provide that required funding to connect the utilities. But that also came with certain conditions they have to meet with. That's how we provide that governance in administering tax, in directing taxpayer dollars to fund the infrastructure projects. And taxpayer dollars, when we put them online, we had to ensure robust grant agreements are in place. And yesterday I read that. And that agreement between the Crown and the Central Alberta Advocacy Center, and the organization promised us to meet many stringent requirements in order to access the funds approved by the government. And we are keen on supporting any viable project, not just this one, any viable project put forward by the private sector to help ensure we build the infrastructure Albertans need. My ministry has established the new Alternative Capital Financing Partnerships Office division within infrastructure, whose focus is to pursue alternative funding to build and maintain infrastructure that save taxpayers' dollars or generate revenue. There is a lot of untapped potential for investors and problem solvers in this area. So we are looking to industry and organizations to come to us with groundbreaking solutions and opportunities to invest. Together, we can provide Albertans with world-class infrastructure to support their needs and house the vital programs and services they require. Thank you again for Red Deer Polytechnic to host us twice in a week's time here. It's been a pleasure for me to spend time here in Red Deer. Congratulations on moving ahead with your Central Alberta Child Advocacy Center. And I look forward to making the milestones along with you in the future weeks and months. Now I would like to invite the chair of the Polytechnic, Red Deer Polytechnic, to give his remarks. Thank you.
Good afternoon, everyone. I'm Jim Brinkhurst. I'm the interim president here at Red Deer Polytechnic. And just to say that if you're going to come to Red Deer every week, we'd be more than happy to have you here with announcements like this. So feel free to come every week if you'd like to make announcements. We would certainly love that. So just want to say good morning to everyone and welcome. Today marks another milestone in the journey of our proud partnership with the Central Alberta Child Advocacy Center. Now, interesting enough, this goes back to 2018, and I know that Mark and Sheldon, Joel Ward and others, we were all in the room talking about a vision of what the Child Advocacy Center could be here in Red Deer. And I know that we signed a memorandum of understanding with that vision, but here we are a number of years later, and we're fulfilling that vision. So I just want to say thank you to your unrelenting pursuit of this goal. So thank you. Our partnership will bring many opportunities for both organizations, and most importantly, our collaboration will continue to support Central Albertans. This is something both of our organizations share as a common purpose. By working together, we support children, youth, and families across this region. We also provide important applied learning and research opportunities for our Polytechnic students. Our partnership with the Central Alberta Child Advocacy Center demonstrates the benefits of our unique path forward as a Polytechnic institution. Through the Child Advocacy Center, we are committed to providing diverse hands-on learning opportunities for our students in a breadth of programming. And just to give you an example of some of the programs that will link to this Child Advocacy Center: social work, psychology, sociology, education, early learning and childcare, educational assistant, kinesiology and sports studies, and nursing. We recently began a trauma-informed workforce micro-credential in which students will collaborate with the Child Advocacy Center. And we will continue to create additional opportunities for learners in other programs that will help support the goals of the center. With practical experiences, observation, and applied research, and other initiatives, our learners will connect with leaders in business, industry, and not-for-profit. These valuable opportunities permit students to learn about and solve real-world challenges facing people in our communities. Graduates of our programs will be well-equipped to contribute to their knowledge and skill set to the important field of child advocacy. The need is growing, and Red Deer Polytechnic is pleased that our facility and students can continue making meaningful contributions to the sector. Red Deer Polytechnic and the Child Advocacy Center both have roots in the region. We are proud to be part of effecting positive change and opening doors for the diverse people who live and work in the region. I can't say enough of how pleased we are that the new Central Alberta Child Advocacy Center for Excellence building will be located on our campus. We look forward to inviting you back to our campus to celebrate an official opening when construction is completed. So thank you. I'd now like to introduce Mark Jones.
Good afternoon, everybody, and thanks for coming. It's great to see so many faces here of familiar people that have taken this journey with us. Jim said it perfectly. Our goal for our advocacy center was to have it in a place where we could really create a change the way that we work and deal with child abuse and mental health issues. And to be able to be associated with the Red Deer Polytechnic is a match made in heaven, and it's going to allow us to change the way that we do things and the way we do business in an integrated fashion. Those of you that know me well, I'm an off-the-cuff kind of guy, but today I actually wrote a little something here because I didn't want to forget anything. I just want to thank all the ministries. When you talk about government help and government support, I want you to recognize the number of ministries that were involved in this announcement today. So right from Premier Kenney, Minister Panda, Minister Nicolaides, Minister Schultz, Minister Shandro, Minister Copping, Minister LaGrange, our MLA South, MLA Jason Stephan, and every single MLA in the Central Zone were in on meetings and organizations to talk about the importance of what we were trying to accomplish here at Red Deer Polytechnic. And to me, it's a groundswell of community support and people that want to be difference makers and make things happen. That's what this celebration is today. I have to talk a little bit about Minister LaGrange because she came into the office in our small little bun building. She was newly elected, and she had 30 minutes that she said, I would like to come and talk about that. 2.5 hours after she came, she left, and we talked at length over the next week and a half how we could involve the education world into Child Advocacy Center. Because the kids that come to us, it's an intervention piece. But to do the prevention piece, we need to get the teachers and the counselors and the support staff and the administrators, and we need to get the social workers and the nurses. We need to get everybody educated into what they're looking for and how they can help recognize, so that we can eliminate it as it's before it's happening, or if it's happening, eliminate it as quick as we possibly can, so kids aren't enduring 5-6 years of abuse. So to be able to do that, Adriana helped us create a special program in the education world. She recognized from the very beginning the importance of what we were doing and what kids were, and she has been relentless in the fight for us at the Child Advocacy Center. So, Minister LaGrange, our hats from our organization for you believing in what we're doing. We have a board that has grown from 9-10 people of a coalition into an actual board, and through the guidance and leadership of Terry Lowen, we wouldn't be where we are now. Terry has been relentless, and as much as the work that we've done there, Terry has been right there with me every step of the way, and it has been an honor to work with him and do things. Our board has been unbelievable support for us, and I'd be remiss, the CAC staff we have and our service providers, the work that they've done in 4 short years. We are now in over 91 communities in Central Alberta where we've worked with at least one child and family, and it's a testament to the work that they do in the office and they do out on the road. So huge kudos to all the staff. Special thanks to Patricia Arango here from the Central Alberta Sexual Assault Support Centre, one of our partners in the building, has been just a tremendous support to us, and she's a huge advocate out there in the world trying to make things better for kids. And Patricia, we love the fact that you're coming with us, and we can't wait to get things started and having coffee every day in the office. Julie and her team at the Central Alberta FASD Support Network coming in the building with us to work with the kids there, to have that, and our partners with Alberta Health Service, and have the step up, step down, and moving all of the outpatient services for the kids in the psychiatric ward and the counselors and play therapists, all to have us under one roof, sharing space in an integrated way, and Sheldon will talk a little bit about that. But the things that Jim mentioned earlier that we're going to be able to do together is, in our world, going to make all the difference in the world. And I don't want to forget anybody, but I do have to give a couple shout outs to the P3 Capital Partner Group that have been so helpful to get us where we are today, and our friends at Vitreo Group and Eagle Builders. We can't say enough about Eagle Builders and the support and how they've gone above and beyond to help us, myself in particular, what building permits look like and what construction timetables are and things like that. So Dennis and Craig, a huge shout out to you and your whole team. Pam Livingston in the Premier's office was instrumental. I remember working with 3 different people to get this, and the last one said to us in September, you're at the 1 yard line, but you're first and goal to go. You're not on 3rd down. So through different things, Pam helped us get this across the line. So a huge shout out to her as well. And a couple things, Sheldon, I'm going to introduce him as the next speaker, so I'm going to do it now before I get into the real heat, because I haven't really started yet. Sheldon has been instrumental in the world of encouragement to our organization and support to get us where we needed to be. And it started out as a friendship, and now I look at Sheldon as being a brother that you talk to 2 or 3 times a week, and you recognize that the things that he's done in our world makes our job exciting, to be able to go and know that we're making a difference. And Sheldon's been doing it for 25 years, and I can understand the frustrations of trying to drive through a door when we've been doing it for 5, And we know the frustrations of the 5 steps forward and the 2 steps back. And it's exciting. Today is a huge excitement. And you're going to hear Amanda Bruin talk. And when you want to talk courage and bravery, you're going to hear all about it. Amanda was the first person we worked with as a child advocacy center when I was called by someone saying their granddaughter, and I thought the granddaughter I was going to work with was 8 or 9 years old, and Amanda was 28. And we said, doesn't matter. She needs help. We're going to help her. And Amanda is a living testimony of when you get the proper structures in place, great things can happen. So we're really proud of you, Amanda. Just a couple things. In order to build this Center of Excellence, we asked our government leaders to step forward and become champions of courage. Today, we feel that the children and families served in our community are being seen and heard. This makes us as an organization both relieved, all the work we've done, but at the same time elated. This announcement by the Government of Alberta provides the crucial financial backing required to transform a courageous and ambitious vision, the Center of Excellence, in something that is decidedly real and tangible. It's a milestone moment today. The Alberta government has provided funding support to the CAC for many smaller projects that we've done, as well as our core funding that they do allow us to do our daily work. This is the first provincial government funding announced for this building project, and it's at a transformational level. This funding will support the critical infrastructure required to bring the interconnection of utility services to the new facility on the Red Deer Polytechnic campus. This will cover costs associated for the 3 main areas of infrastructure services to the CAC site and will support infrastructure to the broader Red Deer Polytechnic campus. Together with the UCP government and our Red Deer Polytechnic partners, we're bringing to life a one-of-a-kind model in Canada, and it will have a home right here on the college. And if you looked out the window right behind me in that open area there, this is what you're going to see transformed in the next year. This funding announcement affirms that our government leaders are declaring that children who risk coming forward need all the help we can muster. These leaders are acting so that victims of child abuse and mental health issues find the very best supports at what could be their most vulnerable time. They're acknowledging that we need to bring a comprehensive community of help to our children versus leaving them to seek their own help. To have provincial government recognize the possibility of a building like this can create, it gives our team more motivation than ever to get the job done. Every dollar given towards this project is another dollar that lets children and youth know that adults who are in a position to make decisions hear them and believe them and support them. An announcement like this one today is what happens when a community rallies around its people, its young people in particular, and asks the government to believe in working differently for our children and youth. Today's announcement is a springboard for a Center of Excellence that will allow us to work with our children who have suffered abuse and struggle with mental health. This building will allow us to seek work-integrated practice opportunities for our future nurses, doctors, lawyers, psychologists, counselors, social workers, and educators. Before I wrap up with my last little thing, I looked out there and right away I saw Darcy and Dave Will, and I forgot to thank them. I don't know anything about leases. I don't know anything about negotiating with banks, but they do, and they have been unbelievable helping our organization. So a huge shout out, and they have volunteered every minute. And then I also look at all of our supporters, and I can't name you individually, but you know who you are, and all the things from those that have danced for us, that have worked with our golf tournament and have worked everything else. We wouldn't be who we are today without every one of you and your hands lending to our organization. So thank you from the bottom of my heart, all those people. Our motto at the Central Alberta Child Advocacy is Be Brave. Our children show bravery when they come forward and say that an adult has hurt them or they need our help. Our community has shown bravery by supporting us for the past 5 years in every single thing we do. There is never a time where the community haven't said, we're in. Our government now has shown bravery by getting our centre to the finish line. And for that, our organization will be forever grateful. We are incredibly grateful to everyone involved in helping make this dream a reality. Eagle Builders, are you ready to get the shovel in the ground? Because we are. Thank you. Gives me great privilege and honor to be able to introduce a great friend of the Advocacy Center and a great friend to kids who are at risk, Sheldon Kennedy.
Well, it is quite a day, and thank you, Premier Kenney. I've been doing this work for a long time, and your support has been unwavering, and we need that leadership and support for an area that was overlooked for a long time. So thank you, and thank you, Minister Panda, for your support, and I think open-mindedness to bring all of this ministry, all the different ministries together to have one announcement, to make this happen. And Minister LaGrange, thank you. Thank you for your leadership in this space. If you look at what happened in this funding announcement, it's basically exactly what we want to achieve in the Child Advocacy Center. And that's having all the entities that have a piece of this to work together to get the best outcomes possible. If you look at kids that have been impacted by child abuse, kids that, the outcomes that come, it's kids that have been abused are 30% higher dropout rates in high school, 15 times more likely to attempt suicide. Over 72% of people in treatment centers as adults have disclosed early childhood abuse. The list goes on. The list goes on. And we need to be able to connect the dots. And I think when we look at the ability of the Red Deer Polytechnic School and our opportunity to measure, to learn, and to teach a different way, integrated practice, sharing information in the best interest of the child to get the best outcomes possible is a taught skill. We have to teach that. And that's what we're going to do. And this is not just about Red Deer. There is 7 child advocacy centers in the province of Alberta, I think over 35 across Canada, and they all need help in this space. And we are going to be the center of excellence to give them all a hand. We want to be the leaders, not just in Red Deer, not just in Alberta, not just in Canada, but globally. I have been in many places internationally that are struggling in this space, and nobody was in a position in this area with the legislation around the Children's First Act to allow for information to be shared in the best interest of the child like Alberta was, and we need to make sure we're taking advantage of that to the best of our ability, and today's announcement allows us to do that, and we are committed. The last thing I heard from Eagle Builders was on budget and on time. Thank you. Amanda. This is Amanda, and Amanda, I met Amanda and we sat, it was at the Red Deer College. We sat at the Red Deer College in 2018, and I couldn't be more proud of this young lady. Just, this is what it's about. People living in good recovery, and that's what we need to hear more of, and what an asset you have in your community with this young lady.
Hi everybody, my name is Amanda Bruin, and I am a survivor of childhood sexual abuse. My abuse started when I was 8 years old and lasted until I was 14. I never had anybody to go to. I lived with that guilt and that shame for over 20 years before finally coming forward in 2015. In 2015, there were still no resources like the Child Advocacy Center, and I ended up having to go to 3 different RCMP detachments to finally get my case brought to court. Not only did I have to tell my story 3 times, we also made 25 court appearances. Again, without the support of anybody or a center like this. I'm thankful that I had Mark Jones and Sheldon and Terry Lowen to support me that entire time. But now the children of today will not have to do that. They will not have to go and retell their story 3 different times and live that trauma over and over again. Every time that story is brought up, your mind is remembering it, your body is recalling it, and it is absolutely terrifying to come forward. As Mark said, the slogan is be brave, and that's all it takes is one brave person to come forward to end child sexual abuse. My case lasted for over 5 years. before going to trial, and then 2 trials were delayed. As a child, I can't imagine having to do that. As an adult, it was even more emotionally devastating to me. Mark, what you guys have done with the Advocacy Center is just absolutely mind-blowing. I remember that first conversation with Sheldon and Mark, and I believe Terry was there as well, where it was about fixing life and fixing things. You know, I destroyed my life in order to in order to prevent reliving that guilt and shame. Having aspects like the Central Alberta Sexual Assault Clinic to be able to have the mental health there. It's a one-place location where your needs are fulfilled, and you're not having to retell your story to different people. They all will be able to see your file, so you don't have to relive that and continue reliving it every new, mental health person you're seeing, every new RCMP officer that's interviewing you. I'm extremely fortunate today that I am living in a recovery lifestyle. I am an advocate for the Advocacy Center. My whole heart goes into this Advocacy Center. I never want to see another child be vulnerable, especially raising children myself. I can't imagine them going through what I've gone through, and I just want to thank everybody who's been part of my journey and my story. And all the support here today shows that, obviously Red Deer and Red Deer Polytechnic is making a huge investment in our future. Thank you.
So just to wrap things up, we just want to thank everybody that's here today, recognizing that each and every one of you have played a role. And last shout out to Ken, our mayor, and Sean, the former mayor of Sylvan Lake, who from the municipal government side of it, and Sean opened doors for us in our communities where we have got out to 91 and communities, and that was a lot of that was because of you, Sean. So really hats off and shout out to you guys. But thank you so much, everybody, for coming. We have lots of exciting announcements that we'll be making over the next several months in groundbreaking and opportunities that we're doing things with the Polytechnic and things like that. But from the bottom of my heart and every child that we're going to make a difference for, thanks for everything that you've done up to this point in time for the Child Advocacy Center. A huge shout out, as Sheldon said, this is transformational, moving for a government to have so many ministries involved in something and believe in the work we're doing to give our children and youth who are vulnerable opportunities to have their life back. So we will remember it forever, and it will be part of the legacy of the Central Alberta Child Advocacy Center, the support we had from the government and all the ministries. So kudos to you, and thanks so much for all your belief and your support. But thanks for coming, everybody, and just stay tuned for lots more exciting announcements over the next year. Thanks for being here. Appreciate it.
We'll move on to the media Q&A now. We have some reporters here in person, so please identify your name, your outlet, and who you'd like to direct your question to. Go ahead, Shayla.
Thank you. Shailan Skalski with CTV News. My question is for the Premier, and I apologize, it's not related to this announcement, but one made earlier today. Premier, just seeking some clarification on an answer you provided to a colleague a couple hours ago in regards to the future and potentially having to reimpose restrictions yet again. You did mention we can't predict the future, but I'm wondering, should we see an increase in hospitalization and unfortunate deaths? Is your government prepared to reintroduce restrictions?
I'll answer this reluctantly because I did already take nearly an hour of questions earlier today, just to say that Alberta will always do what's necessary to protect our hospitals and our healthcare system, but we have every good reason to believe that we can move on beyond COVID, get our lives back to normal like the rest of the world is doing. And I know there are some in the media who would like to just drag us into constantly living in perpetual fear. I think most Albertans want to move on, get our lives back to normal with high vaccination rates, high levels of population protection, increasing healthcare capacity, special efforts to protect the vulnerable in nursing homes and elsewhere, and new drugs coming on stream. I am very confident that we will be able to move forward with this as an endemic. We don't know 100% what the future holds, but after 2 years of this upending our lives, we simply have to get on to learning to live with COVID and getting our lives back to normal.
You have a follow-up, Sheldon?
I do, yes. Moving in the other direction, do you have any benchmarks or timelines for when we might move into step 3 and drop the remaining restrictions in place?
Sure. The only remaining restrictions are a requirement to isolate if you have symptoms of COVID, and masking requirements and other protocols in nursing homes and hospitals. Those will stay in place for the time being until we see a significant step down in hospitalizations. We don't have a specific number in mind, but it would not be any earlier than 3 weeks from now. We would want to take at least 3 weeks to monitor any impact from the phase 2 reopening today.
Thank you. Do we have any others who'd like to ask a question? Go ahead, Sheldon.
Sheldon Spackman, RD News Now. Do you have any indication at this point when we might see shovels hit the ground on this project and what the construction timelines look like, and a rough estimate for an opening of this Centre of Excellence?
Yeah, Sheldon, thanks. That's a good question. So right now we're currently working with Red Deer Polytechnic to get all of the fine details done. But if we were to be able to live in a world that we would think everything would go, we would love to be shovel in the ground summertime if possible. And according to our builders, Eagle Builders, once we're in the ground, we should be able to move into that building 12 months after. So we're hoping to be into that building sometime 2023.
And just as one follow-up question, the partnership with RDP, when would RDP students be able to get a hands-on and fully integrate with this Centre of Excellence?
Yeah, so we already are doing programming with RDP right now. We've had some internships and we've done lots of presentations here at RDP, not only with their students but with their staff, and now we're fully engaged with all the new Polytechnic staff and things like that to move it forward, and with President Brinkhurst.
Thank you.
Thank you, Sheldon. Any other questions?
Hi, Paul Cowley, Red Deer Advocate. This is for the Premier. Sylvan Lake Ambulatory Care sent out an email last night that they had to reduce hours today because of staffing shortages, and this has happened several times in the last few weeks. Just want to know if the government is looking at this and what their plans might be to prevent this in the future.
Well, thank you. I'm not familiar with that particular email, it's not possible for me to track the day-to-day status of our 108 hospitals, but I can tell you this budget increases the health care funding by $600 million on top of a $900 million increase in the health budget last year. So that's a $1.5 billion increase in health care. We're spending more on health by far than ever in our history. We continue to spend more per capita than any province. We have more nurses and more doctors working in Alberta's healthcare system than ever before. It's true that through COVID there has been more absenteeism as health workers have had often to self-isolate. And in some rural areas that were already had some staffing issues, that has exacerbated the problem. Perhaps that's part of the issue in Sylvan Lake. I'd be happy to ask our staff to look into that and get back to you, Justin. If we could get health to respond on the particular issue in Sylvan Lake. Let me add that our budget adds specifically $90 million of additional funds for the retention and recruitment of rural physicians, as well as the Reside program that will set aside a certain number of seats in Alberta medical schools for young Albertans coming from rural communities who have the intention of going back and serving those communities. We also proactively added to the Union of Nurses a collective bargaining agreement an additional, I believe, $7 million for the recruitment and retention of rural nurses. And we are spending hundreds of millions of dollars on capital maintenance and repair and expansion of healthcare facilities, including across rural Alberta. So there are significant investments, but I think from time to time there are workplace challenges. That's not something new. Unfortunately, it's true right across rural Canada, and it's a bigger issue that we all need to work together to solve.
Do you have a follow-up?
We'll get you the more particular answer from health on that.
Yeah.
Hi, Dwayne Rollheiser with Todayville here in town. Considering that massive investment in central Alberta made in adding hundreds of hospital beds, you think that if there is a time where, I guess when there is a time another pandemic comes in the future, would you be more comfortable giving responsibility to emergency management versus the public health officials?
Well, first of all, adding healthcare capacity is urgent so that if we face a future virulent wave of a pandemic like this, we don't face the risk of running out of ICU beds. So that's why we're making these additional investments and a broader action plan to increase capacity. But in terms of, look, the Emergency Management Agency of Alberta is basically a central coordinating body with logistics experts. They don't have any public health expertise per se. In fact, in Alberta's pandemic response plan that has existed for decades, it is an assistant deputy minister at the Department of Health who becomes the incident commander for the Alberta Emergency Management Agency when a pandemic is declared. So in fact, functional responsibility for pandemic management comes back into the health department. And the main governing legislation for a pandemic is not the Provincial Emergencies Act, it is the Public Health Act that has existed in law since 1910 and has been updated many times, which invests significant authorities in the Chief Medical Officer of Health and the regional chief medical officers. So under the law, for over 110 years, they have been the officials primarily responsible for pandemic management. So I know there's this theory that some former bureaucrat has been circulating that a couple of military guys who are experts in logistical coordination on fighting forest fires and floods should be centrally responsible for pandemic response. That doesn't happen anywhere on the face of the earth for obvious reasons, and it's not contemplated in Alberta law. So that stuff is internet chatter. It does not actually have any connection to reality or the law.
Then why have that agency?
Eh?
Why have that agency then?
Well, the Emergency Management Agency is there as a coordinating body to bring together all the different players when there is a particular emergency. So, for example, if there's big forest fires up north, they will bring in, they'll coordinate the efforts of the wildfire fighting service with the municipalities, with the First Nations, with transportation, with Indigenous relations. They bring them all into one big operations center, and they are the coordinating body, but they don't have any particular expertise for issues like pandemic response.
Can I get one more in?
Sure, go ahead.
Is there any regrets when you look back on this? I've talked to several doctors and patients over the last 2 years that had taken treatments that at first they were allowed to and then they weren't allowed to. And there are various treatments. I know that the general public talks about ivermectin, hydroxychloroquine, but there are probably about 20 treatments that have been used around the world with various success rates. Are there any, looking back, do you wish that you would allow doctors to look further into these treatments, or are you happy the way that we kind of just went straight to vaccine as the only solution to this thing?
Well, the regulation of drugs and their administration is not within the authority of elected officials. You do not want politicians deciding which drugs people should take, period, full stop. I don't understand why people keep trying to politicize a medical issue. We have regulators who are responsible for reviewing and approving safe use of drugs with specific parameters. In our case, that would be Health Canada, and they receive applications from companies. In the case of ivermectin, the company that produces it has never made an application for ivermectin to be authorized for use against COVID-19. So how could Health Canada approve a non-application, first of all? Secondly, the College of Physicians and Surgeons, which does not come under the government's authority, it is a self-governing regulatory body responsible to the physicians themselves. They are responsible for regulating the use of drugs to ensure that drugs are used safely. And they do, as I understand it, allow a fair degree of discretion for physicians to determine the appropriate therapeutics for a particular disease. But the answer to your question is, I have lots of regrets about COVID for sure, but I'm not, and nor should I be responsible for which drugs are approved and how they are used. That's up to Health Canada and the College of Physicians and Surgeons.
Thank you.
Thanks, everyone. Today.